A new study shows eating fish regularly may help reduce that risk of colon cancer. Dr. Harry Thomas, a gastroenterologist at St. David's Medical Center, joins us this morning to talk more about that research. That's a tough one for me to say. Thanks so much for coming in.
Thanks for having me.
We appreciate it. We've heard other research before talking about how good fish can be for you. This is just more evidence that it's a good choice when you want to eat some meat.
That's exactly right. This study looked at about 500,000 people over 10 countries in Europe and followed them for 15 years with detailed questionnaires about what they're eating. And at the end of the study, they found that those individuals who are eating the highest amount of fish in their diet had about a 10% lower risk of having developed colorectal cancer than those who ate less than one portion a week.
Pretty significant. And we see a lot of research, I guess sometimes the percentages are almost where you can't really account for it, but this is a significant number.
It is significant, and part of it may be that people eating more fish are also eating less in the way of red meat, processed meat, that we do know is a risk factor for colorectal cancer.
You know, I've noticed that certainly true for me, and especially true for my wife who's trying to eat a lot of fish. When you prepare a fish dish, you tend to have healthier sides to go with it and stuff, as opposed to what happens when you're grilling or something like that. So it gets into, you know, cheat meals versus day in and day out meals. Like we said, moderation can be so important.
That's right.
What are some of the other factors for colorectal cancer and for just overall good colon health in that area?
Yeah, well, really the biggest thing is getting screened for colorectal cancer. There are many different screening tests out there, but with colonoscopies, we're able to not only screen for the cancer, but also prevent it by looking for these precancerous growths or polyps in the intestine and then removing those and decreasing the risk for colon cancer.
Yeah, we talked about that before we came on. That's just so important, that this is a cancer that's not treatable. It's preventable if you stay on top of it, and that's just such an exciting thing.
That's exactly right. There are other risk factors, including the red and processed meat, avoiding smoking, avoiding excess alcohol, and trying to maintain a normal body weight.
Yeah, and those factors we show there for colorectal cancer, like we say so many times when we talk about health, if you're working on attacking those factors, it's probably pretty good for overall health and many other challenges to your health as well.
That's exactly right.
Yeah, but once again, the fish, it's been proven that is a good choice for meals. And you were talking about other, I forget the terms you use, but other types of fish, not the white fish, are still pretty good for you?
That's right. So this study really showed most of the benefit was with fatty or oily fish. Those are fish like salmon, sardines, tuna, but there may also be a small effect with white or lean fish like cod or tilapia.
Yeah, and that will get into shellfish as well.
That's right.
Depending on how you prepare that. Very good information. We appreciate it. Dr. Thomas, thank you.
Thanks for having me.